What causes the swings between hyper and hypothyroid symptoms? We have a long presentation online called the No BS series on Hashimoto's. You should watch that. That would probably be the best answer. But the semi-short answer is so many things. Okay, so there's 40 different triggers. So here it is. You have autoimmune thyroid disease, all right? And there's various stages to it. There's a relatively stable Hashimoto's patient where they just don't have a lot of thyroid symptoms. Their antibodies aren't very reactive and they don't go up and down like that. Then you get into the reactive. It's actually called the reactive Hashimoto's patient. And when you get into that patient, that's the patient that we're talking about right now that goes up and down. You'll go up and down based on not particularly the antibodies. They can sometimes be a good check. You check antibodies to determine if you have Hashimoto's. And I've already done videos to say the number is not the issue. I can have people who have Hashimoto's thyroid peroxidase enzymes, which is the enzyme you measure, of 50, and they'll be up and down and all over the place and hyper, and then I can have somebody comes in and have Hashimoto's 20,000, and they're stable to a large degree. So that's another whole subject. But the point is that's not the measure of going up and down. So it's just based on your triggers, really. It's based on how unstable your thyroid is. So what makes it unstable? What makes it unstable is we all have different microbiomes, we all have different immune systems, we all have different stress responses, and we all have different tissue resiliency, whose tissues have proper sugar and proper blood sugar and proper oxygen, whose inflammatory processes are low. All of these play into how susceptible a patient is to getting an immune response. Let's use gluten as an example, because gluten is the number one trigger probably for autoimmune thyroid disease. Iodine could be another one. Taking iodine, maybe you're taking an iodine multivitamin that has iodine in it, and for autoimmune thyroid disease, that's one of the top triggers for it. So you may be going along and everything's fine, and then you expose yourself to one of these, and then the immune system flares up. To make a complex immune problem simple, the immune system flares up inflammation. Inflammation causes your antibodies to flare up. It hits your thyroid, and depending on the condition of your thyroid, you can get hyperthyroid symptoms, anxiety, panic attacks. You can get heart palpitations, inward tremors, night sweats, all those types of things. Then the attack is going to eventually stop. Now, gluten exposure might bother you for 3 days or 3 weeks. It just depends on your sensitivity and your physiology, just like COVID right now. The people who have diabetes, the people who are overweight, the people who are already immune suppressed by drugs and stuff, they're going to be more susceptible to the COVID than the person's not. Same thing with your thyroid. Certain people are going to be more susceptible. Now, as time goes on, and maybe you don't know what all the triggers are for you, as those triggers keep beating up your thyroid, not only are you going to intermittently get the hyper symptoms, but when they calm down, your thyroid itself is going to be going into hypo, slowly going into hypothyroid. And frankly, it probably has been in hypothyroid for a while already, because your thyroid can get beat up for like 7 years before you start getting the Hashimoto symptoms. And so you got this hypothyroid, and you're tired, and you're fatigued, and your hair's falling out, and your bowel, you got constipation, and you got edema around your ankles, and dry skin, and so on and so forth. And then all of a sudden, so you're in hypo state. It's called Hashimoto's hypothyroiditis. So you're in a hypothyroid state because your thyroid's been getting beaten up, and as it gets beat up and it starts losing more tissue, you start having less function to be able to put out thyroid hormone. You start getting hypothyroid symptoms, and then enter the hyperthyroid symptoms. At some point, you start getting the reactions. You start get to each trigger, and so it really is a matter of you were originally in a hypothyroid state, and eventually you started to become hyperthyroid, and then the intermittency is I've been exposed to a trigger. Maybe it was a stress. I cannot tell you the number of people I've had come in here who have hypothyroid and don't know they have Hashimoto's, and they've only been diagnosed with a hypothyroid, and here's the first part of their history. And one day I just got really, my heart started pounding, it started beating out of my chest. I ended up in the hospital. They asked me, what I did. I didn't do anything. They checked me, and my heart was fine, and they told me that was stress or electrolytes, and here, drink some Gatorade, and I'll see you later. And so that's the development of somebody who has Hashimoto, who's in hypothyroid. They were under stress. Stress is one of the triggers that'll flare it up. Maybe they went out and ate a pizza and a beer that night because they don't know they have Hashimoto's. And so there's gluten all over beers and pizzas, and maybe that was enough between the stress to set off a thyroid attack. Your heart has 10 times more receptor sites for thyroid hormones than any other thing in the body, any other organ in the body, and now you're going like this. So they went from hypo to hyper, back to hypo. Other things that you should be aware of that can cause it would be like a viral infection can cause it. So if you're like hypothyroid and you get maybe a COVID. Okay, I've had a number of people who've come in here who have gotten triggered by COVID, had their Hashimoto's triggered by COVID. But it could be Epstein-Barr, it can be cytomegalovirus, it could be herpes virus, it could be the flu. Okay, the viruses like to find their way into your thyroid, and that'll cause it, and then it'll go down. Excessive iodine, when people are taking like little bits of iodine, and maybe they're not taking iodine, there's a trigger that's pretty common, that's why I'm mentioning it. Maybe they go and they eat a ton of shrimp, which has a ton of iodine in it. Or maybe they went and just ate lobster and shellfish, bouillabaisse or whatever it is called. And all of a sudden they're shaky and they're jittery. And then you go back to your baseline. So your baseline is hypothyroid, and then the jitteriness is you've hit some sort of a trigger. Another thing that can cause it, by the way, is over medication, but that doesn't usually cause up and downs. That'll usually cause you to be kind of jittery, and stay that way. So, I mean, that's really the basic concept of it. The end is if you're going up and down, you're missing a lot of triggers. You need to figure out what those triggers are, and you need to address them.